So, hi to all the viewers. So, today I have with me the proud achiever of All India Rank 12, Dr. Vartika Saini, in the recently conducted NEET Assist September 2023 session. So, hearty congrats to you, Dr. Vartika.
Thank you so much, sir.
So, how are you
Thank
feeling
you.
now?
So it was really unexpected. Initially, I was actually feeling very numb. I was not expecting this result, but yeah, I'm really, really happy now and
So, I
feeling
think
relieved as
uh,
well.
you have got one of the ranks with which you can choose any specialty in any college under the purview of NEET assist, right, Dr. Vartika?
Yes, yes, sir.
So what have you finally decided upon?
So probably between oncology and endocrinology, I'm stuck, but more
So,
inclination towards oncology, so still.
okay, actually, two specialties are two extremes, I would say. Usually, the students I've interviewed are often confused between endocrinology and rheumatology, both being non-intervention specialties. Of course, oncology is sort of the same, I reckon. Right, Dr. Vartika?
Yes.
So, what have made you inclined towards oncology? Were you interested from oncology from the very beginning of the residency, or any particular reason for that?
Actually, yeah, to some extent from the starting, since it's a really, really evolving branch. Plus, it includes research as well. Plus, it's a more of like what we study in daily, day-to-day articles. We have to apply that to the patient. Apart from reading the books, definitely we have to read books. But yeah, the ever changing every week the drugs are coming up, the treatment is changing, and that we are applying to a patient, the clinical trials that are ongoing. So and plus it is somehow connected to medicine as well, as the very in a form of paraneoplastic syndromes as well. So like oncology.
Yeah, you are exactly right, Dr. Vartika, because if you select a premier institute like Tata Memorial Hospital, they have a lot of ongoing trials with regards to the newest molecules that has not even come to the market, is in the pipeline. So you get a lot of
Yes, sir.
exposure with regards to the latest development in the field as well, and you get to try and that to the patients as well. And it's an ever-changing specialty, rightly, as you rightly pointed out. So
Yes, sir.
before, please.
Actually, in the previous era, it was quite different. Oncology was perceived as quite different, but
Absolutely.
now after the coming of the immunotherapies, so it's
Yeah, the
changing.
checkpoint inhibitors, the cyclin kinase inhibitors, everything has really revolutionized the way we manage
Yes,
cancers.
sir.
Even now, the stage 4 cancer can be controlled, or the progression-free survival can be pretty much prolonged with the help of these medications. So, before moving
Yes, sir.
too much into your preparation strategies, please give a brief introduction about yourself to the viewers, where you are from, the colleges which you have studied, and the year which you have passed out.
Yes, sir. So I'm a resident of Ajmer, Rajasthan. I have done my MBBS from Gitanjali Medical College, Udaipur. Then I have done my post graduation from Jawaharlal Nehru Medical College and Hospital, Ajmer. And I have completed my MD in July 2023 only. And I have appeared for the super specialty exam for the first time
This
and
is
have secured
obviously
a
your
rank.
first attempt, and this is I'm lost for words to say that a first attempter is getting the rank number 12. That too, not in the specialty exam. This is all the students clubbed together, attending the exam together, and that is one heck of an achievement, Dr. Vartika. Once again, big congrats from the entire Dr. Tutorials family. So,
Thank you so much, sir.
how did you manage to crack this? You have your final exams, say in the month of June or July. You hardly had 2 to 3 months for dedicated preparation for NEET ss. So how were you able to balance the preparation for both your theory and practicals, and alongside for the NEET ss?
Actually, sir, I had started my preparation from the end of the second year. Then I had started making notes from the Harrison, and if I felt that some topics are important, I had read some topics from super specialty books as well. So I had made my notes. I had completed like major subject notes till the like end of the third year. The remaining subject notes I got printed notes. Uh, so my strategy was to have the notes in the last minute, or the last 1 to 2 minutes. I should have the notes of the major subjects along with the small subjects with which are given less weightage in the NEET. So this is how I prepared notes. And since we have long case of neuro, so I studied that thoroughly during our third year. And it really helped in this NEET essays also. Plus uh, like the notes really helped me in the my theory exams as well. Apart from that, when I had finished with my theory exams, I joined doc tutorials, question bank, and test series, because I had not practiced much of the questions at that time. So I joined in the last 1 to 2 months, and I practiced MCQs, and the question bank was Harrison based. So the lines which I missed during the reading, or which I have not noted down, which it was covered in the question bank. And I had also given the elite test series. I saw the discussions that really helped me, in boosting my preparation. Actually, the I was again and again seeing the test series videos, because when someone explains the answers, so it's gonna stuck there in your mind. You're gonna remember it forever.
So actually,
So
the one good thing that the change in pattern of the NEET exam has brought to the freshers over the last 2 years is that they are appearing for the final examination as well as for the NEET SS reading from a common textbook, that is Harrison Medicine. So
yes, sir.
whatever you read, the notes that you prepare will be helpful for both the exams. That is why if
Definitely.
we look at the top 100 rankers this year, we can see there is an overwhelming majority of the freshers, and which was not the case previously when you have to prepare based on a super specialty book where you are able to appear for only two specialty like an endocrinology, neurology, or nephrology, where you have to study the individual books. But that scenario has completely changed. I think it's more of a boost for the freshers, right, Dr. Vartika? I
Definitely,
think we
sir.
have made the most
Definitely.
of that advantage. And
Yes.
regarding doc tutorials, elite test videos, I think we have not discussed that part in the previous interviews as well. We have now the elite test video videos of the two last 2 years, 2022 and 2023, and there we have discussed around 220 or 225 questions per individual specialty with detailed explanations. I think that would cover most of the important areas of the entire subject, right, Dr. Vartika? Do you agree with that?
Definitely, sir. It would cover, plus as well as the topics covered were the very hot topics, which would definitely have a question. And the video discussion, the detailed discussion is really helpful for preparation.
Yeah. And for those who are appearing for INI exam also, they have to attend that 25 or 30 questions that are coming from medicine. So now that it may not be much of an issue because this NEET SS September and the INI is very close by hardly 1 month separating that. So you all are fresh from the NEET SS examination. Even otherwise also, all those viewers who are listening now, one good method of preparing for the INI medicine part is you have to focus on your individual specialty, and for medicine you can go through all the QRP videos, and if you are able to go through these elite T&D videos as well, that would be more than enough to cover for the important areas with regards to the medicine questions. So just asking
Definitely.
about INI, you have got such a wonderful rank. Do you still want to go for the INI? Are you writing the INI?
No, sir.
No, okay, okay. Have you already applied for INI and now uh, changed your decision to not write INI?
Yeah, sir. I had applied, but now I've changed my
Now that
mind. I
yeah,
had given in April as well,
okay,
but that time I didn't qualify, as my preparation was not up to the mark at that time.
Okay, you had given the medical onco at that time, right?
Yes.
Yeah. Okay, so you have Dr. Vartika, you have mentioned about the test series that the doc tutorials have offered. I think we had given around 17 or 18 tests in total, which is by far the most number of tests that any platform has offered. So, did you appear for the test on time, or did you appear for the test all at once towards the fag end of your preparation?
No, so actually, when I joined, it was around like GT 7 or 8. So I started from that only. And when I had given first GT, I felt the quality of the test was like really, really good. The questions were selected from the tables, from the topics which we usually don't remember. We had to revise again and again. So from that GT 8, I was not able to score that much score. So from that test, I decided that I'll give it in the span time for the 48 hours. It's live. Then the next test I used to give in that period only.
So, what was the average score or the average rank which you were getting on the remaining 8 or 9 GTs that you have consistently appeared?
So initially in my first test, it was around 200. Like it was the scores were really less at that time. But after that, when I started reading and solving question banks, then I started getting ranks in under 100, and in the last 4 to 5 GTs, it was under 50. So it really boosted my confidence at that time.
Yeah, absolutely. When we had gone through the toppers list in the GTs that we have conducted, I think almost everyone who has been scoring consistently under 50 has got the eventual rank under 50 also. We has had the interviews with so many toppers also, and everyone has given sent all of the faculties personal messages also regarding how the doc tutorials GT can exactly mimic what is actually happening on the day that matters. Okay. Now, now, Dr. Vartika, what advice do you want to give to the students who are in their second year of residency, who are just entered third year, who might be confused on how to balance between the preparing for their final exams as well as NEET tests? What one piece of advice that you will give to them?
So that it should be case wise approach initially in the starting of the second year. It should be case wise approach. The individual should analyze the important cases. He or she should make the. I mean, he or she should study in deep the important topics, because this time also the topics which were covered in the NEET essays, they were from the cases which we usually see in our day to day wards. And also plus sometimes since you have time, if you are in second or third year, you should definitely read some journal or articles, because the topics which are trending in these articles, they would definitely ask one or two questions, like for example cardiac sarcoidosis, uh,
Exactly.
and of course the notes should be ready by the end of the third year, whether printed or whether handwritten notes, they should be there, so that you can revise them multiple times, and multiple revisions are required, because no one's gonna remember in one or two readings. And question solving should definitely be there. You should not skip this MCQ solving, because it will always enhance and it will always boost your memories. And it should be ideally done in last 4 to 5 months, or maybe 3 to 4 months is sufficient. And daily we should increase the MCQ solving capacity. And giving GTs is really important, because every GT covers questions from every specialty. That actually trains your mind. Otherwise we are like if we are studying gastro, we are more used to solving gastro MCQs, but while giving GT we get used to solving the specialty questions. So our mind gets trained like that only during the final exam. So it's really important to do all the things, and to utilize the time. We really have to balance actually. We have IC duties and emergency duties, so whenever you are getting time, you should read.
Yeah, I think the two important messages Dr. Vartiga has conveyed is that I would choose the word balance. One, of course, you have to balance between the preparation for your final exams as well as NEET tests, and also to balance between the preparation of all specialties. You may have one or two favorite subspecialties from all these 8 or 9 specialties that we have, and that is one mistake that student often makes. He may be wanting to go for a gastro, cardio, or endocrine, so that he or she may be focusing too much on that specialty, aiming for the INISS exam. But of course, when you take specialties like endocrine, rheumat, or nephrology, we have only a handful of seats in INISS. So they get lost when they appear for NEET tests, where all specialties are given almost equal importance. So
Yes, sir.
yes, definitely. And from the experience with the toppers whom I have interviewed over the last couple of years, one common message that I've got, which has rightly been echoed by Dr. Vartika, is that they have started reading Harrison from the end of first year or towards the second year itself. That may not be targeted toward NEET assess. They are targeted towards having a consolidated base knowledge, and very importantly, making notes either alongside Harrison, or you can make a separate note incorporating few facts from the specialty textbooks or the articles that you have read. So rightly, as Dr. Varthala pointed out, by the middle of third year your notes should be ready, so that you don't have to go back to that voluminous textbook again and again and read through the lines again and again. So you have to make a mini Harrison like notebook along with you by comprehensively reading the Harrison, and then comes the time of revising the notes. And at that point of time, I think MCQs will be the most helpful in retrospectively helping you in making you adding up the additional points which you have read in the which you have missed in the initial reading, and that would really help you to boost your preparation. Right, Dr. Vartika?
Definitely, sir.
Yeah. So, okay. So now it's time for you to rejoice. I think it's been almost 5 days since the results have come, and
Yes, sir.
probably by next month onwards, the counseling will start. And I presume that you will be taking up DM Medical Oncology in Tata Memorial Hospital, right?
Probably, yes, sir.
Yeah. So all the very best there. I think the residency schedule is also a bit hectic on the hectic side in Tata Memorial, but I really think that you will really enjoy it, because as you are more into the specialty, into the intricacies, and you are very much fascinated about the subject also. So all the very best for your future residency career, and to have a bright future ahead. All the best for all your personal and professional endeavors. Thank you, Dr.
Thank you so
Saini.
much. Thank you so much.